Good afternoon. I'm Michael Bohan. I'm a physician. I'm an addiction medicine specialist. I'm working in Virginia. My interest in addiction started in Chelsea Naval Hospital. It's no longer there. I guess Chelsea, Massachusetts, by the Tobin Bridge. Anyway, I started working in alcoholism treatment there, helped introduce alcoholism treatment to the Navy. Continued in the Navy, and my last tour in the Navy was at Naval Hospital, Portsmouth, where as chief of medicine, I ran into number of patients who were dependent upon benzodiazepines. They would be coming to my office looking for an increase in dose that their doctor wasn't going to give them and such. But anyway, I started a clinic then and started using long-term detox programs using diazepam. And I'd like to tell you what I think is one of the most important things, and maybe this is a little class we're going to have now, and that is, and then we're going to start off with this phrase: all addicting drugs cause the symptoms they're designed to relieve in time. That is, all addicting drugs such as opiates and sedative hypnotic drugs, alcohol, they will cause the symptoms they're designed to relieve in time. An example: you prescribe opiates for pain, and you take it for a while, tolerance sets in, you have to increase the dose, you stop the opiates, what do you got? More pain. Benzodiazepines, take it for anxiety, gradually increase the dose over time, stop it, and more anxiety. The anxiety, of course, with the benzos is long-lasting, and not like the withdrawal from alcohol and the opiates. Opiates are shorter withdrawal, but not with the benzos. A few patients seem to get off okay, but most don't. Most seem to have a protracted, and that's where we have to step in. So what's going on here is I'll call it an uncalled for, an unexpected, prolonged misery. And this is something we see over and over again. I'll just give you some examples. I walk onto the psychiatric unit, I hear this wailing going on, and that wail I've heard over and over again from benzo patients in a high dose that have been stopped. No one wants to go see that patient. The nurses don't want to go to see the patient. I remember walking into the unit and I heard the wailing. I said to the patient's doctor, "I'll take that patient." And so he says, "You will?" And so, because I knew what the problem was and we knew how to treat them. But that's the things like this are going on all too much. So getting back to the little class again, all addicting drugs cause the symptoms are designed to relieve. So this is a dual effect of addicting drugs. This is a paradox. This is just a truth contained in the opposite. And people have a hard time grasping it. I think most pharmacists and doctors don't seem to get this idea of the dual effect of addicting drugs. Okay, well, anyway, thank you very much.